Hello. Today I'm talking about the inner ear. It has a major role in helping your balance system, and your hearing also has a major role. It's a part of the hearing process too. So some of the diagnosis can be fixed based on what your problem is. So I'm going to start talking about what the part of the ear that we're working on. So right about your cheekbone, right about here, there is a size of your size of a mole. There's a semicircular canals that are attached to the ears. I'll put the picture in later on. So they look like this. I had to take tissue paper and put them in. One is for anterior canal, one is the horizontal canal, and one is the posterior canal. I hope you can see it. So when my head goes down, the anterior canal knows where it is going. So when my head goes to the side, my horizontal canal is working. Now, this bad boy works. Posterior canal works when I'm going backwards. So those are my fancy 3 canals. I made them out of tissue paper, and they're not that big, just for the record. So right where the semicircular canals are attaching to a little piece called that looks like a seashell called the cochlea. It's called the vestibule. Now, in between that area, there is little sea cells, sea salt crystals. They are called otolith. It shows gravity and linear acceleration. The canals show, like I said, the position or movement in the frontal, sagittal, and transverse planes. Okay, so in labyrinthitis and Meniere's, patients are usually hard of hearing and they have tinnitus. Tinnitus is the ringing of the ears. So usually for most vestibular patients, I do recommend patients putting the head of bed up a little bit to help drainage to happen naturally in the neck area from the arteries also, and from the lymph and the fluid that is building up in their head naturally. I recommend people putting humidifiers in their houses also for that reason. If they have nausea, I highly recommend they talk to their doctors. They can get meclizine or dramamine, which is very good. I wish I bought stocks in them. They would have been the best stocks in the world. Anyway, so in the canal and the vestibule, we have a little bit of fluid in there. It's called the endolymph. When you check, so usually what happens is when you have pressure from the sinuses or cold, your whole sinus parts that are here get inflamed and throw the fluid in there. So along with it, if you have an infection in the lymph, in the larynx or the pharynx area, you are actually pushing all that up the eustachian tube that in end gets the drainage opening up here. So it's very important when I tell my patients they have to hydrate more. If you're not drinking enough water, you're not decongesting yourself. Water kind of helps get the mucus loosened up a little bit to get out of your systems a little bit more easier. Okay, so the next one we're going to talk about is while I exercise with patients, I usually tell them to check for hand-eye coordination. So when your hand-eye coordination exercises come into play, tapping a ball, throwing a ball to someone else and catching it instead. It's harder for people when they even have a sinus infection or a cold because it's so much to focus and distracting. You have your internal cranial nerves activated when you're doing all that stuff. The other one is, working on coordination exercises for balance, single limb activities, and strengthening to reduce hypotonias. Okay, I'm a very fan of postural training, so I usually work on the mid-back. I work on holding the neck upright positions. When they're first working with me, unless I'm very confident that they are not, they're familiar with their ground with their feet, I make them look down usually because it gives them confidence that they know what they're doing and they are actually doing a better job of walking. The step length gets better. Even though these tiny little things that are here are causing the problems, the hip gotta know that it's doing a good job, so it'll continue doing the walking. Our job is to keep them agile, to keep them flexible, to strengthen their muscles, not to go the other way around. Most of the antibiotics and even the blood pressure medications, I can't remember right now, they have muscle weaknesses. That is a side effect, but you need those medicines, unfortunately, to help you get better so you are independent and less medications down the road. So you need to strengthen those muscles. Physical therapy is such an important thing for these patients. Only red flag that I say is if you have a new onset of headache and a sudden deafness, make sure you tell the doctor immediately. Do not hold it back. They have to either refer you from the ENT to the neurologist or do some testings to figure out what's going on. Okay? Do not wait for those changes, usually. Okay. So the first one I'm talking about is misinformation of the cranial nerve, vestibular nerve, which arrives from the which is important. The vestibular nerve is part of the 8th cranial nerve. It gives the input to the brain about balance. It causes vestibular neuritis. The input it's received in the semicircular canal and the vestibule that is given to the brain. So the sea salt crystals that I was talking about, they're called the otolith. They're very tiny. They're like little dots. When they brush on the little follicles or little hair-shaped things that are inside the semicircular canals, so inside the canals that I was showing you before, they have a little like hairbrush. So inside the canals, in the beginning part, so if this is my semicircular canal, hold on a second, gotta put my card down first. So in the beginning and the ending of the canals, there is hair follicles right about here. So what it does is the otolith that's coming from here, the attaching part, when they get pushed into here, they send the wrong information. All of a sudden, like, oh, I'm dizzy. You might be sitting still and you're like, oh, I'm dizzy. I don't know what's going on. So that's a normal feeling that they have. Because it's a body structure, the fluid doesn't have a place to go. So it kind of like makes it hard on labyrinthine neuritis patients. So you'll hear that they're dizzy the first few days. Consistently, they will be dizzy. After that, they've probably been on antibiotics by the doctor, and all of a sudden they'll say, oh my gosh, I get dizzy only when I move my head, which is good. That's a good sign for us. So for them, remember to teach them. They may have nausea, so you want to teach them to hydrate a lot more, so that when you do the testings and you're doing all the procedures, their body is ready to help adapt to the situation that they have. Okay, so lemonade with ginger helps to calm down the tummy. It resolves with physical therapy. They will be trained how to do a Dixol pike on their own next time labyrinthine neuritis comes, because if you have a cold, you're bound to have another cold again. I'm sure of that. They must have dim lights at night so that when they wake up, their eyes will be able to focus on something and they can get up safely. Because, you know, just as your 8th cranial nerve is over here, you have the other 3 nerves that are here: the abducens nerve, the and you have other eye nerves, the trochlear nerve and the abducens nerves and the oculomotor nerve taken over. So we can use those nerves to send the input to the brain faster. Hey, you are lying down, your head is flat, you're gonna sit up, you're gonna wait 30 seconds so that the fluid that is moving around your body, just like the arteries, are having a time to just calm down a little bit. And then when you get up, your hip will activate on its own to stand. Your knees and your ankles will help you to stand up safely. Make sure the place is clutter-free so you can get up and walk safely to the bathroom and back. Okay? In general, most patients are are able to be resolved will be taught Dexhall Pike. I don't want people to do Epley unless they have been shown. I will have a video of Epley in my YouTube channel in case someone wants to review it, but they should not do it unless recommended by the doctor or the PT. Alrighty, take care. The doctor usually checks out for hepatitis, herpes, Epstein-Barr, your TSH, urinalysis, and if needed, the doctor will recommend you to audiologist also, okay, because of the hearing. So, alrighty, I will see you again.